Our diet and high cholesterol have always been blamed for diabetes and heart disease. What if I told you that the real culprit isn't in your food, but is in your gut? Please allow me to explain. My name is Dr. Ennin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Today, I'm going to be talking about the hidden toxin that is in our gut. There is a hidden toxin being produced by a certain gut bacteria that may be silently sabotaging your blood sugar, blocking your medications, and even inflaming your arteries. And it's called imidazole propionate, and it's more common than you think. So let's dive in. So what is imidazole propionate? Imidazole propionate is a gut microbial metabolite produced when bacteria digest histidine, which is an amino acid that is derived from certain foods such as red meat, cheese, eggs, nuts, and seeds. Now, each time you eat meat, eggs, or fermented foods, you could be feeding bacteria that produce this metabolic toxin. So in the gut, you have the microbes, you have the microorganisms that lives in the gut, and they are in the right balance. So when there is an imbalance, a good bacteria can become pathogenic, can become bad, can become poison to the system. And that is why it's very important that we maintain a good microbiome. So these are normal flora, they live inside the gut peacefully when they are in balance. But when there is an imbalance, then it can cause a cascade of symptoms. And that's what I'm going to be talking about is driving at. So how does the imidazole propionate come about? So this imidazole propionate is a metabolite by the bacteria. So when this good bacteria, when it's overpopulated, it causes histidine to produce this imidazole propionate, or in short, IMP. And this IMP can potentially cause insulin resistance, diabetes, and cardiovascular disease. So how does this come about? So first, the IMP activates the mTOR pathway and it shuts down insulin regulator signaling, which leads to insulin resistance and high blood sugar. So what this IMP does is it blunts metformin. Most diabetics are taking metformin and they are not seeing an improvement in their metabolic health. And this could be one of the reasons why most people taking metformin is not working, because metformin works through the AMPK pathway. Now, guess what? This IMP inactivates the AMP pathway and making metformin ineffective. And this can be a clue that if your metformin is not working, chances are you may have high levels of IMP. And that is just something to think about as we dive in. Now, the IMP also triggers inflammation via the TLR4 pathway, and this increases oxidative stress. It promotes atherosclerosis, leading to hypertension, coronary artery disease, and even stroke. So what are some of the signs or clues of IMP toxicity? The first one is high glucose despite effort to lower it. Yes. And the second one is metformin resistance. Yes. So you are diagnosed with diabetes, you are watching your diet, you have been given metformin, yet your blood glucose is not budging. It's a sign that IMP may be high, because metformin works by activating the AMPK pathway. And guess what? This IMP deactivates this pathway. And another thing that may give clues to IMP toxicity is persistent fatigue, brain fog, erectile dysfunction, and early cardiovascular issues. So these are all things that will point us to the direction that it may just not be about our diet or cholesterol, but we may have to look at other areas, particularly the gut. So who is making all this IMP in the gut? And like I said, this IMP is made by our own gut bacteria. And these bacteria sit in our gut and they are normal to us. And it only becomes a problem when there's an imbalance in the normal flora, in the microbiome. And there are three common ones that causes this IMP to skyrocket. And the first one is called Prevotella copri. And the second bacteria is Clostridium bolte. And the third one is Egatella lenta. These are all good bacteria, but when there's an imbalance, become pathogenic and cause problems and lead to higher levels of IMP. So what do we do in the real world situation? And you and I will agree that when you go to your doctor and you have diabetes, uncontrolled diabetes, you have cardiovascular disease, your doctor is looking at your cholesterol numbers, your endocrinologist is looking at your medications, what is working and what is not working, and probably your diet. Now, in my space as a functional medicine practitioner, what I do is I look at the gut microbiome. Yes, I will look at the gut. And how do I look at the gut? By stool testing my patients, because there's a comprehensive stool test that can tell us that if we have this bacteria present. I'll look at the gut microbiome, I'll look at insulin resistance, and I'll look at the inflammatory markers. The second thing is to treat the root. So treating the root means that we need to make sure that we are giving this kind of patients what we call spore-forming probiotics. And we introduce antimicrobials. And when I talk about antimicrobials, I'm not talking about prescription antimicrobials. Keep in mind, if you are even using prescription antimicrobials, you can use it for X number of days, because continually using prescription antimicrobials can be a problem long term. Besides building resistance, it can also damage the gut microbiome. So when I talk about antimicrobials, I'm talking about botanical antimicrobials. Those are the ones that you can use extensively for long term without damaging the gut microbiome and improving our health. So that is what we do in terms of treating the root. And of course, detox support. You have to support the liver. We do all that to make sure that we have a fair balance of our microbiome and everything is working right, because the liver plays an integral role when it comes to these things. And the other thing is that we do a nutritional reset, and that is taking out processed carbohydrates, because processed carbs can affect the gut microbiome and cause this dysbiosis. Alcohol can cause dysbiosis and therefore can increase IMP levels and cause problems such as heart disease and diabetes. And fermented meat, and these are all things that can also affect IMP levels by way of the gut microbiome. So the other thing that we also want to do is we want to include fiber-rich foods, because fiber-rich food is able to blunt the effect of this pathogenic bacteria in the gut. So adding fiber-rich food is very, very important in trying to get over this pathogenic bacteria. And also we want to be eating low histidine vegetables and fruits, and of course including polyphenols such as the green tea and the pomegranate, and of course fasting. Fasting is always a big thing. I've heard people say that when you fast it can cause ulcers. No, as a matter of fact, fasting heals the gut. It's one of the tools that I use in my practice to fix gut problems and gut issues. So when it's all said and done, we use targeted supplement. We have supplements that blocks inflammation. We have supplements that will restore the insulin signaling. We have supplements that will support the detox and fix the gut lining and also reset the microbiome. So these are all tools that we use. Now let me talk about a patient that we had. This is a 52-year-old gentleman who came in and has been on metformin for 6 years and was also on Ozempic. So we did the stool test, and the stool test revealed that he has high levels of Prevotella in his stool. So once we determined that, we did a gut-focused intervention. His A1C dropped from 10.2 all the way to 5.3. So the Ozempic was discontinued, cholesterol normalized, and guess what? His NPT returned. And what is NPT? Nocturnal penile tumescence. And that is the erection that you get in the middle of the night. He had lost it for years. Once we were able to fix this, his nocturnal penile tumescence returned, meaning that his erection returned, meaning that his early morning erection returned. So what is the key takeaway here? This is what I want you to take home with you. 1. IMP blocks insulin and damages blood vessels. 2. It's linked to diabetes, metformin resistance, and cardiovascular disease. It's also driven by dysbiotic gut and poor diet. Yes, poor diet and dysbiosis or imbalance in the gut causes IMP to rise. Gut reset can reverse metabolic disease. And I want to repeat that. Gut reset, focusing on the gut-based intervention can fix your diabetes, can fix your cardiovascular disease. So it's not entirely about your diet, it's not entirely about your high cholesterol, but your gut. And that's why we have good people embarking on good diet, have normal cholesterol, yet they suffer the heart attack, they suffer the stroke, they suffer cardiovascular events. And that is because of their gut dysbiosis. And the last takeaway is standard treatment fail without gut intervention. And I want to repeat that. Standard treatment, meaning that you go to your primary care doctor, they give you the metformin, they give you the glipizide, they give you the glimepiride, they give you the Jardiance, yet you fail without gut intervention. So gut intervention is a big key in our metabolic journey. And unfortunately, in mainstream medicine, that is not done. And this is my final message. If you are struggling with diabetes, heart disease, or even erectile dysfunction, don't just change your medications. Change your microbiome. Connect with Green Health Functional Medicine Center and let's get to the root of the problem for you. And as always, thank you for allowing me to explain. Thanks for watching. I will see you in the next video.